Hello there. My name is Allie Virtue. I'm the owner and founder of Parkside Nutrition, an online nutrition coaching company. I am a functional medicine nutritionist, nutrition coach, etc. Chronic nutrition nerd, shall we say. All right, so today's video is, are your shits normal? Are your bowel movements normal? Let's talk about it. Nobody ever talks about it. So we're going to talk about, we're going to talk shit all day, but we're going to talk about frequency, quality, easy to pass, hard to pass, most of your poop related questions, hopefully. If not, feel free to drop it in the comments below, but let's get started. All right, so the problem is nobody talks about this, right? What's normal? What's just common? What should we be looking for? What notes should we be taking? What red flags should I be aware of? And then obviously, how can you help if you do have a problem or you discover that you have a problem? My head is just in the way here. So normal versus common. Normal, and this is where it gets difficult because if you look at medical definitions, anywhere from 3 bowel movements per week to 3 bowel movements per day is considered normal. So if you're outside that very, very wide range, then you might be abnormal. So that can get confusing. So I want to help you obviously figure out if you are normal, if you have a problem, etc., etc. But what is typical for you is really where we need to start. So start paying attention to your normal patterns. What is normal for you? Then that way you at least know if there's a sudden change, then we can kind of look deeper, but we'll talk more about it. So what's common? Well, problems are common, but they're not necessarily normal. So constipation. So again, if someone is classed as constipated, they're having less than 3 bowel movements per week, potentially. Or they went from, maybe a higher frequency, moved towards more constipated or less bowel movements. So for the US population, that's about 15 to 20% of adults. That's pretty common. That's a lot. That's a very common problem, can we say, but it's not necessarily normal. So we don't have to, we can strive for higher feats, right? If we want more bowel movements, we can get more bowel movements. Diarrhea. So chronic diarrhea. So people who are dealing with this on a chronic basis, not just temporary, pops up, upset stomach, things like that. 1 to 3% of the population. So far less common. Heartburn. We won't talk too much about this because we're mostly talking about bowel movements, but 20% of the population suffers with heartburn. Irritable bowel syndrome, so IBS, is about 15%, and then inflammatory bowel disease is less than 1%, so much, much more rare, but I think it is growing in, I don't want to say popularity, but it's becoming more common because it's being diagnosed more and more. So how do we know if you are normal? What is normal for you? So we'll talk about some symptoms that you may or may not be experiencing, and then ultimately lab testing can be really helpful. If we have this wide range of, quote, what normal is, lab testing can be a really great objective tool to use. All right, so good signs. Overall, smooth digestion that truly goes along in the background, doing its thing without me really having to pay attention to it or micromanage it is really good. But what is that? So smooth digestion, ideally, bowel movements are easy to pass. And science likes to classify things. So we have this beautiful Bristol stool chart here on the right. And we want to be anywhere from 3 to 5. 4 is AA+. Very well done. If that's the work that you're putting out every day, very good. But otherwise in this range in the middle. So we don't want the extremes. We don't want really hard, like small, hard to pass bowel movements, but we also don't want really watery, no solid pieces, entirely liquid. Those are a problem. So we want to be right in the middle there, 3 to 5. Smell, some people on the internet will debate this, that your poop shouldn't stink at all. I think that's probably not going to happen. It's bacteria waste. It's fermenting. It's a scientific process. I feel like it's going to have some odor, but especially foul smell or a big change in smell from your normal might be indicative of a problem. And if there's a significant change or rapid change, that's not easily explained by just eating something different. No visible food particles. So we don't really want to see broccoli in my waste. I want to digest that broccoli and turn it into something different. So ideally, we're not seeing too much visible food in our waste. Some things we're going to see, like nuts, seeds, those things are designed to just survive the digestive tract, but hopefully we're chewing our food really well so we don't see too big of pieces. And some other things like corn typically are not digested very well. But I don't want to see things like full-on like supplement capsule or, too much food waste in there. I really want to try to digest my food to the best of my ability. So you can be aware of that. It's not a huge red flag, but I put it on there anyway. And we do not want to see any blood. that should be obvious, but that is something that we do not want to see, and that can be a red flag, and we'll talk more about that. Color, this really depends. Really depends on what you're eating. What you're eating can influence the color of it. Color dyes. So if you have like blue icing or something that has a dye in it, it could obviously change your waist. Medications can impact it as well. Supplements can. Some foods like beets can turn it a more reddish color as well. And then vice versa, if you have a lot of greens in your diet, it can turn more of a green color as well. So it varies, but again, knowing your normal is helpful. All right, so red flags. Black stool. Black stool is usually dried blood, and it's indicative of a bleed in the upper GI system. So this could be from like an ulcer that has bled in the upper GI tract and traveled down, and so it looks black in your waist. And then it could also be something from medication changes, iron supplements, something in your diet, but that is definitely something to note and to reach out to your provider if you see that happening. And then on the other spectrum, pale white stools, also a red flag, and you should probably consult your medical provider, for that one, if you see that as well. Hard to pass or really loose watery stools. So we talked about that, right? We don't want really hard to pass stools. Those can cause straining. That can lead to hemorrhoids. And then also we don't want super watery liquid waste, because that's a sign that we're not digesting our food to the best of our ability. We're not absorbing a lot of the nutrition in our food, and then potentially puts us at risk for dehydration as well. Like I said, visible food or capsules or supplements. I've had clients that say, hey, I saw my supplement. I think it was a performance supplement in my waist. And I'm like, that's not good. That's a sign we're not digesting, or it's not a high quality supplement. So note on that one as well. Foamy, floating, or hard to flush. These are indicative of not digesting our fat very well. So fat is oil, right? Or oil is a fat. And fats don't mix well with water. So that's why the waist is floating and it's hard to flush sometimes. And this could be steatorrhea. So this can be from a number of reasons, but it could be if it's happening on a chronic basis. You know, if you get the occasional floaty stool, it's not that big of a deal, especially if you just had a high fat meal. It's fairly normal. But if this is happening on a chronic basis, this could be bile duct inflammation. This could lead to low vitamins A, D, E, and K, because those are fat-soluble vitamins, and we might not be absorbing those the best we can if this is happening. This could be liver inflammation from the liver not making bile. Bile helps break down our fats. This could be from the pancreas not making digestive enzymes to help us break down the fats. And then also small intestine might not be doing its job either. So it could be for multiple reasons, but if it's happening on a regular basis, this might be something to ask your doctor about. And quite often they'll do a stool test to see. So red flags for colon cancer. I'll put my face over here. So a sudden change and a sustained change in bowel habits. So if you know your bowel habits, hopefully, if there's a sudden change and no other obvious reason, like you didn't forget to drink water and your diet is relatively similar and things like that, or you haven't been traveling, or any of those obvious kind of things or reasons for a change in bowel habits, this would be something to potentially reach out to your doctor about. There is also in-home kits that you can do for stool testing, and that could be a good first step. If there's any blood in your stool, so visible blood, not the black tarry substances, that could also be a red flag for colon cancer as well. It's kind of hard to say whether diabetes, diarrhea, constipation, any of those, or feeling of like incomplete bowel movements can be a sign of some problems as well. Abdominal pain, aches, cramps that don't go away, and especially unexplained weight loss. Quite often a decrease in appetite as well, but we're not absorbing our food. We're not absorbing the energy that we need from food, and that can kind of cause that unexplained or that sudden weight loss. All right, so let's talk a little bit more about color. Everybody's favorite topic, probably when we're talking about poop. But so the brown color of our waste comes from bile. So bile, like I mentioned, is something that's produced in the liver, and it is stored in the gallbladder and then transported into the small intestines, and that helps break up the fat that we eat into smaller pieces, and then we can absorb it. So if we're not either producing bile from the liver, so maybe the liver's inflamed, or it's stuck in the gallbladder and it can't get through the bile duct to go into the small intestines, this can leave our waste looking pretty pale, white, clayish colored. So not good, not what we're looking for. And so if you do see any of these signs, please reach out to your primary care provider and start asking some questions. This, like I said, can also be due to a blockage in the bile duct. And this usually causes nausea, fever, itching, yellow skin, jaundice, yellow eyes. And there are a couple conditions that can cause it, but nutrition-wise, usually the ones I see are primary biliary cirrhosis or primary sclerosing cholangitis. So this is basically inflammation, usually autoimmune in nature, but of the bile duct. And so that bile that helps break down the fat is not getting to the small intestines, and usually that person is not digesting the fat that they're eating. It's going usually straight through them. It can also be from liver disease, like I said, if we're not actually producing the bile to get to the small intestines, gallstones, so there could be a blockage in the gallbladder, or certain medications might influence our stool color as well, but that's why it's generally brown. Common problems. Okay, so constipation, diarrhea, bloating, irritable bowel syndrome, IBS, or inflammatory bowel disease, IBD, and there's a couple types of those. Diverticular disease, SIBO, hemorrhoids are probably some of the most common bowel problems. Oh, I forgot this part. So diverticular disease, you can have diverticulosis or diverticulitis, and it's kind of the stages. So diverticulosis is just small defects in the muscle wall or the colon wall. Diverticulitis is when you have actual infection or inflammation of those abnormal pockets in your colon. So what would I recommend initially, obviously without a ton of information, for these particular conditions? So constipation, usual elimination diet. You're going to see that a lot with these things. Elimination diet is just really great for clearing out common inflammatory foods, and we can start to really find out what foods work well for you, what really help expedite healing, and then what we need to remove on a longer term basis that was potentially contributing to some more inflammation. Increasing fiber. Fiber-rich foods, and then also water. You have to do both of those at the same time. If you increase fiber without enough water, that can cause constipation as well. So it's quite often we see this when people are like, hey, I'm eating so healthy, or I've started to eat healthy and I'm more constipated. What's going on? You need to increase both of those at the same time to get the best results. Increasing movement, exercise. This really helps stimulate the bowels to move a little bit and to help them clear things out. Bowel training and timing. So going to the restroom at the similar times, same times, most days. So giving your bowels that opportunity and kind of training that muscle memory and that your body's natural rhythm can be actually pretty helpful too. So this is when you go to the bathroom, give yourself 10 minutes or less. You don't want to be sitting there for too long. Then we put ourselves at risk of hemorrhoids. We don't necessarily need to strain, but again, just trying to get the timing down and giving your body an opportunity to create a bowel movement. And of course, there's a lot of supplemental aids, but those are usually need to be pretty specific to the person and their goals and health history, etc. Loose bowel movements, so diarrhea, elimination diet, usually trying to figure out what inflammatory food is causing it. This could also be from a high-fat diet if someone is having some gallbladder issues and they're not digesting their fat terribly well. Quite often the body gets the food it can't digest out of the system pretty quickly, so this can cause loose, urgent stools. Even if stools are loose, we still need to hydrate because we are losing more water than our body would typically absorb. So we do need to hydrate. Still, I would say stress management plays a big role into this as well. A nervous stomach can definitely contribute to this particular symptom. And then fiber. Fiber actually helps absorb some of the water in our intestines, so this can create more bulk and make it less urgent and loose. On top of that, I would say multivitamin. One, because if we are not digesting things, if they're going through too quickly, adding some nutrition into the system can be really helpful. And then also some digestive enzymes to help break down. So if it is that case where we can't break down the fats efficiently, you can look at bile salts, adding bile salts, supplemental, ox bile, or digestive enzymes might be helpful for that scenario as well. And then as far as testing, stool testing, since we're talking about poop, stool testing is going to be fairly useful. You can also look at exocrine pancreatic insufficiency, and that can be done through a comprehensive stool test as well. And you can check if I am actually creating enough digestive enzymes to break down my food properly. That can be helpful. And then also looking at the balance of gut bacteria that you have through that stool testing as well. There's other inflammatory markers you can test for as well. And then also SIBO test. SIBO can cause constipation. It depends on the person as far as what their bowel habits might shift towards. And then also assessing blood sugar as well for that. That can be very helpful. All right, so irritable bowel syndrome slash bloating, usually that person would experience both, and then inflammatory bowel disease. So like I said, this IBS is much more common than IBD. IBD is usually diagnosed through a colonoscopy, and they see visual inflammation. So you can see the inflammation present. IBS is usually a collection of symptoms that you don't necessarily see active inflammation on a colonoscopy. So those are a little bit of the differences there. Both, I would say, that person could benefit from an elimination diet. One, because it removes common inflammatory foods, and then usually increases anti-inflammatory foods to help heal that state of inflammation. A low FODMAP diet, this just tends to remove some of the fermentable fibers. So temporarily, this can be really good for reducing bloating and discomfort in that area. And both of these, I would say, trying to find an adequate amount of fiber is really helpful as well. Some IBD clients can't really tolerate a ton of fiber, but I do think that's something you could build up to, because it is helpful to have, for other reasons, a relatively high or moderate fiber intake. But sometimes that takes working up to that. Digestive enzymes, helpful in both cases, because usually it will help further break down the food. This also lowers our chance of developing SIBO, so small intestinal bacteria overgrowth. And so if we're not digesting our food, that leaves more food to be fermented by bacteria, and that could potentially cause an overgrowth situation. So adding some digestive power onto that can be really helpful, but you should work with a provider to find a good digestive enzyme, because some people, if they have heartburn or GERD present, that's not a situation that we want to add HCl or stomach acid with that digestive enzyme, and some brands come with that. So find one that fits all of your needs. Stress management is key, especially with IBS. They're finding more and more psychological factors or emotional factors to do with IBS. So we can't really leave that out. Don't leave out therapy or those other psychological benefits or aids with this particular type of situation. And then sleep quality. Sleep is when we are doing a lot of rest and digesting and repair for our tissues and body in general. So making sure that we have really good sleep is really, really important to this equation. As far as testing, like I said, colonoscopy is really helpful to rule out a lot of things. Stool testing, lactoferrin is an inflammatory marker that's usually present with IBD situations. And then a SIBO breath test SIBO can be really helpful, and that will indicate if you have an overgrowth situation as well. Another thing, I didn't put it on here, but you can test if you have H. pylori, and that's a bacterial infection in your stomach that can cause some SIBO-like SIBO. So small intestinal bacteria overgrowth. Most of our bacteria is supposed to be in our large intestine. So if it's in the small intestine, enlargements, that's when SIBO is typically classified. And it's usually diagnosed through a breath test. And antimicrobials, so this is where working with a medical provider, not just a nutritionist, is really helpful, because they can potentially prescribe medications to help with this. You can use some supplements, but sometimes people require medication to help eradicate that overgrowth. And then slowly introducing prebiotic and probiotic. So this is high fiber foods that feed good bacteria. Bacteria are the probiotic part. You can do this through foods or supplementation. Movement is also really helpful, because then we are helping that digestion or the food in our system move through the digestive system at a regular interval. Sometimes if it gets slow or backed up, or we're not getting the muscle contractions in our guts to help that food move through in a timely manner, that's when we can have some overgrowth problems. And then a probiotic supplement that's geared towards the person is really helpful as well. Let's see, diverticular disease, elimination diet, finding a moderate amount of fiber, or the right amount of fiber that doesn't irritate that condition, but is still beneficial to the gut bacteria, is something that you can work with a nutritionist to kind of find your happy level. And then hemorrhoids, hydration is basically anything that would be good for constipation would probably be good for hemorrhoids. So hydrating, movement, fiber. Don't spend long time straining on the toilet, because that just perpetuates the problem. And then consider getting a squatty potty. I think this could go for any of these conditions. I think a squatty potty is great. But let's see, colonoscopy, that's usually how diverticular disease is diagnosed. Stool testing can be helpful for SIBO and or a breath test. But those are generally those recommendations. So hopefully you learned way more about poop than you ever thought you probably wanted to. But if you have thoughts on this, if you have comments, I would love to know. Did you learn anything? Did you learn something new? Feel free to put that in the comments below. But before you go, I would love it if you could like this video, subscribe to the YouTube channel, and if you're interested in more Free Shit Fridays, make sure that you subscribe to the email list in the description below. And thank you so much for watching.